just explain to us, if you would, the impact of this increased intensity of the Israeli offensive on Gaza City on the relief effort.
Thank you, Samantha. What our teams have seen on the ground is a much higher frequency and intensity of proximity airstrikes, very close to our facilities, very close to the routes that we use to move our health workers in, to, and from health facilities. And also we have seen how tanks were approaching within a range of less than 1 kilometer from our health facilities. This, we know for a fact, it is an indication that the risk of turning into collateral damage multiplies exponentially. This is what we have seen, but obviously we are also following on the civilian toll, which is as well staggering. Day by day, people are terrified and living under the bombs throughout the day and throughout the day. There is no stop.
And in Gaza City itself, what is the status of the hospitals?
There are very few remaining, not fully functional. We know for a fact that Al-Rantisi Hospital and many others had to close down after being hit. We are continuing our support, even in the distance, to Al-Shifa Hospital, the biggest in Gaza City, to Al-Hello, the maternity, where there are only pregnant women waiting to deliver or newborns. And we struggle yet to get them fuel, to get them more supplies. The Israeli authorities are not coordinating any of our movements. So hence, very few, and the very few only functional, may be only lasting for a few days.
And how many medics are still working in those hospitals?
Ministry of Health staff, as our staff, they have families. Some of them are relocating to the south. Some of them are making their best effort to find transport, to find a plot of land where to erect their tents here in Deir el-Bala or Khan Yunis. But most of them as well, some of them are trying to stay. They say they will stay and deliver until there is no other choice. Some of them even say that they will die with their patients. We hope it will not be the case. According to many estimates, there is still between 300,000 and 500,000 people in Gaza City who are not going to move.
You occasionally get reports of some people, children, being evacuated and treated in hospitals, either in nearby countries or indeed in Europe. We've got some here in Great Ormond Street. How are those evacuations happening?
They are happening not at the dimension and the scale that we would expect, nor the pace. Just to give you an idea, there are 15,000 patients waiting for a medical evacuation outside of Gaza because there is no way that they can receive the specialized treatment here in the Strip. There are many countries that are increasing a bit their programs to enroll patients for medical evacuation. But again, it seems it is just a teardrop in the ocean. We are trying to advocate to bring in governments and Ministry of Health from different countries, and we appreciate all those efforts, but we really need much more if we don't want to look back with anger to the past, that as the days go by, I see there is no more remedy to that.
The IDF wants people to relocate from Gaza City down south. They want them to go to Al-Mawasi. They say that there are facilities there. What are you hearing about the state of the facilities that are available down there?
We are supporting many of the facilities as Doctors Without Borders, many only field hospitals, many primary healthcare clinics that we have built up from scratch. We are also supporting public hospitals with our partner of the Ministry of Health. There are other organizations as well supporting as much as we can. What is important now is that still, if between 500,000 and 1 million people are going to relocate from Gaza City to the south, there will be not enough beds to hospitalize all the severe patients, not enough clinics for the primary health and preventive activities. This is a fact. No matter what IDF or the Israel government says, it is not enough.